Hi there everyone and welcome to this special edition Osler video. My name's Todd Fraser. It's my great pleasure today to introduce Dr. Lennie Derde, who is an intensivist based in the Netherlands and is heading up the European section of the REMAP-CAP study. Lennie, welcome to the video.
Thanks, Todd.
Lennie, the last couple of months must have been very busy for you. Can you describe what it's been like?
It's indeed been quite busy. So I remember us having a meeting half January in Belfast, a critical care reviews meeting. This was actually a time where we got together with the International Trial Steering Committee of REMAP-CAP and we discussed this infectious disease outbreak in China. And I think since then the work has taken off. There's been a lot of work on research and we've had a surge of coronavirus infections in the Netherlands as well. So our academic hospital, we have about 24 ICU beds usually, and at the peak of the surge in patients, we were running in 3 different locations, 80 ICU beds. I think many people around the globe have experienced something like this. It's not something we've experienced before in our careers.
Now, I understand that part of what you've been doing recently is to extend REMAP-CAP into the ward areas. Can you tell us a bit about that?
Yeah, definitely. So you know about REMAP-CAP and about the adaptive design that it has. It's an adaptive platform trial. And when this pandemic started, we soon realized that the disease we focused on in the interpandemic period, which is severe community-acquired pneumonia, so patients with respiratory infections in the ICU, that was not this group of people as the people with this disease. Because in this disease, contrary to regular CAP, the people are ill for a couple of days, usually at least a week, before they end up in the intensive care unit. And there are 2 things. So first of all, we had to change our inclusion criteria because CAP can't occur by definition after you've been in the hospital for 2 days. And second of all, the week of progression in illness, that's a period where you would logically want to start treatment and you would want to investigate which treatment is best. So that week of deterioration gives us the opportunity to treat patients early in the ward, and it made a lot of sense to us to extend towards ward patients to see if we can improve the outcomes for patients already before they hit the
Lennie, what has that meant for you in terms of REMAP-CAP? Have you had to adjust anything to be able to accommodate pre-ICU patients?
Yes, so there's been a lot of work from the global team, especially by the group of Derek Angus in the United States and Steve Webb and colleagues Colin MacArthur in Australia and New Zealand, and our global project manager, who's Cameron Green. And they, together with the rest of the global group, have rewritten the protocol, so to say. It's not rewritten. This adaptive platform trial allows substantial amendments to go in, one by one during the course of the trial. And that's what happened here. We have what we call a pandemic appendix to our core protocol, which describes what changes during a pandemic. We have specifically changed this pandemic to facilitate these changes.
And what do you expect to find in the pre-ICU sort of space? Do you think that there will be many differences in outcomes and influence of various drugs?
Yeah, so if you think about this disease, then the chance of an antiviral working when the patient's been sick for more than a week is not that high. So there could be a differential treatment effect for antivirals between patients earlier in their disease on the ward and later in the ICU. So that I think is very important to investigate. And the other thing we are focusing on, and I think that's also something that's quite strongly developed in Europe, is the immune modulation that we test in these patients. So you could kind of supporting your defenses against this disease may be more important than the antivirals. or maybe a combination is better. And these are all questions that we can answer in REMAP-CAP. And the last thing is anticoagulation. People develop pulmonary thrombosis. We don't really know what the mechanism for that is yet, but it makes sense to think that, if you can treat that earlier, it's potentially beneficial. And the same thing, sorry, I forgot the last one, is for convalescent plasma. So if you take plasma from donors who've recovered from coronavirus and you aid the immune system by administering that to patients, you could also expect that may help them get less severely ill. But you could also postulate, and that makes sense, that if you treat them earlier, you may be able to prevent ICU admission. And the number of patients on the ward is obviously bigger than the number of patients on the ICU. So for the patient group as a whole, we may help them a lot by finding out whether there are early treatments.
Lennie, how many sites are there in Europe, and do you have any plans to expand at this stage?
Yes, definitely. So we currently have about 40 sites up and running in mainland Europe. And the UK team has been absolutely brilliant in that they have managed to go from 20 sites to 120 sites in a little bit over a month. So they are really, really doing very well and contributing a lot to REMAP-CAP. So we recently obtained a grant from the European Commission. So the European Commission was actually the first one to fund REMAP-CAP globally. They funded it in 2014. So I think they had this vision of, being prepared in terms of research for pandemics was a good idea. And they've recently added to funding us for the COVID research that we do. And that allows us to extend to about 250 sites in mainland Europe. So we're very grateful for that.
Lennie, thank you very much for joining us on the vodcast today, and congratulations on all the work you're doing. And we look forward to hearing the results as they come out in the not too distant future.
Okay, thanks, Todd.